Amanda with StraightSmile Solutions, here to talk to you a little bit more about orthodontics, orthodontic cases. And today we're going to be talking about periodontal disease and braces, periodontal disease and Invisalign. We're going to be talking about what this means. And if you've been told you have periodontal disease, can you have braces or can you have Invisalign? And ultimately, let me go ahead and tell you a little bit more. And I'm showing this picture because I don't know if this guy has periodontal disease or not. I'm seeing signs of it that may lead me to think that maybe he does have it, but he may not. So what is periodontal disease? Periodontal disease is a disease or a breakdown of the periodontum, which basically means the attachment of the gums and the bone to the teeth. So we're all born with a certain level of gums and bone attachment. It's no different than if you plant a tree in your backyard. You have to have a lot of dirt, right? Earth to keep it stabilized. And if you try to plant a really tall tree in just a tiny little pot, it's going to fall over, right? It's going to be kind of wiggly. It's not going to be stable. It's the same thing with teeth, right? Now, over time, our attachment or periodontum starts to disintegrate or break down. There are 80-year-olds with really healthy periodontum. They may have almost all their stability that they were born with. And part of this is due to genetics, and part of it is due to environmental factors. So there are certain things that you can do that will accelerate the breakdown of your periodontum. So for example, like smoking, like poor oral hygiene. If you have poor oral hygiene and you let calculus or tartar or plaque sit on the teeth, the acids will help to accelerate the breakdown. Once you have breakdown, it doesn't come back. All you can do is make the area more healthy so that there's no infection, so it doesn't continue to get worse. So you cannot grow your periodontum back. You can just make it more healthy so it's not getting worse, right? Once it's gone, it's gone. There are different surgeries and stuff that can add bone, add tissue, but that's a whole other story. So basically, I know that sounds super duper complicated. So you can get diagnosed with periodontal disease, but it could be active or it could be passive. That means if it's active, that means it's actively happening and you need to do something to stop it so that it doesn't get worse and make it healthy. So usually that means cleaning out the bacteria, cleaning out the plaque, cleaning out the calculus, cleaning out the food, removing any active infection. It might mean some localized antibiotics, stuff like that. Okay. Also, if your bite is not healthy, or the alignment of your teeth is not healthy, this accelerates the breakdown of the periodontum. So that's why we do recommend braces or aligners for people with periodontal disease so they can get their bite and their teeth healthy. So back to this picture. That was a long example, but you can see in this picture that clearly this bite is not correct, right? So those front teeth, lower front teeth, are supposed to be behind the upper front teeth because they've somehow got displaced, moved forward. Now the bite is incorrect, and I can flat out tell you this is accelerating the breakdown of the periodontum. So if this person already has active periodontal disease, this is going to get significantly less, and this patient will likely lose their teeth. So their lower front teeth over time, unless you A, correct the bite, or B, stabilize the periodontum, or most likely both. Anyways, so I think now you get the idea. So no, you cannot tell just from a picture if somebody has periodontal disease. You need your dentist to do lots of things. This will involve x-rays, a clinical exam, some measurements where they call out those numbers, all kinds of numbers, and there's healthy numbers and there's not so healthy numbers. And then you add all those things together and that tells you what's going on with the periodontal disease, okay? But everyone probably age 30, 40 has a little bit of periodontal disease. There's just past or present. It's just really hard not to, you know, because it's just part of the aging process. It stinks, but it's just there. So, but hopefully we're all passive. But in any case, yes, you should get braces. You should get periodontal disease. If you do, you should get braces. You should get aligners. If you have periodontal disease, your dentist will need to keep more of an eye on the case, make sure everything's still healthy during the case. Sometimes it may mean that you may need a cleaning every 2 or 3 months and a check during the braces. You may need a periodontist, that's a specialist of gums and bones, to keep an eye on your treatment to make sure everything's still healthy. So hopefully now you understand a little bit more about the importance of healthy teeth, bones, and gum during your orthodontic treatment. All right, any questions, let me know. Visit StraightSmileSolutions.com. I know that wasn't the most fun topic, but it's a really common question that I get on my website. So hopefully not only from patients, but also from doctors. And people don't quite understand it. So Message me if you have any questions. Doctors, you're welcome to visit StraightSmileSolutions.com. Make an appointment for a complimentary consultation. If you're looking for support to accelerate growth of orthodontics in your practice, don't forget to visit us. Today, we're going to be talking about periodontal disease. I know a lot of people are concerned how you get periodontal disease, how you get rid of periodontal disease, and what, if anything, you can do to improve periodontal disease. So this is just a kind of in-your-face example of what typical, I'd say a severe periodontal disease patient looks like. This is a progressive disease and it can start over time. Usually it starts just because you're maybe not taking care of your teeth so well. Plaque sits on the teeth and gums for a little while. There's an infection that happens as a result. That infection causes breakdown of the gums and the bone that support the teeth. And it's kind of like if you've planted a tree and you have, say, not that much dirt to support the tree, and maybe it's kind of washed away. Well, the tree is not going to be very stable and it might fall down, right? It's the same thing with teeth. So there are some surgeries and there are gum specialists called periodontists that can help to stop the progression of that disease, or with some medicine or some surgeries or some really keeping them clean. And sometimes there's some surgeries that can help to add bone or gum back on. They're pretty expensive and not that comfortable, but they are effective when you need them. So in any case, that's pretty much it. And we're all about braces, orthodontics. What does periodontal disease have to do with that? Well, it has everything to do with that, because if you have periodontal disease, your teeth are not going to move like a healthy tooth. And it's really important for your dentist to know if you have periodontal disease. So that's about that. All right, thanks so much. Any questions? Keep them coming.
Hey, this is Dr. Amanda with StraightSmile Solutions, and keep those questions coming, those orthodontic questions. I had an awesome question today from a patient of one of my doctors. This was in South Carolina. The question was, and remember, all my answers are not a substitute for clinical judgment. You need to talk to your own doctor about your particular scenario. These are just generalized answers for you to educate yourself. I'd rather you come to me than come to WebMD or just searching the internet, because my answers are correct. So, at least I think they are. But in any case, the question was, can I do braces or clear aligners or Invisalign or Damon or whatever we're going to call it with a cavity or with untreated gum disease? First of all, you need to talk to your dentist about that, because my answer would be no. That's probably not the best choice. Your dentist needs to examine the area. There are certain levels of cavities and gum disease that are kind of dangerous and not so dangerous. Does that make sense? Some that can be reversible, some that can't be reversible without treatment. So you need to get more information on your particular medical situation or dental situation. But just a generalized answer would be, from a scientific standpoint, if you have a cavity, okay, some little tiny cavities can actually be reversed. If you brush, floss, use fluoride, okay, they can actually re-mineralize. That's great news. My personal experience and my understanding of the scientific studies is this is more likely to happen in just an regular oral environment, not an oral environment where you're putting a hot trapped piece of plastic over it, because that actually perpetuates more anaerobic bacteria. Anaerobic bacteria can affect the health of your gums and your teeth. So my answer would be no. I don't think I would recommend doing aligners, Invisalign, braces, anything like that with a cavity. That's just my opinion, but talk to your dentist, because they will take a specific look at that particular situation and assess it. Number two, should I do aligners, braces, whatever, Invisalign with untreated gum disease? Basically the same answer. So some types of gum disease could be very easily reversible in a matter of days. I mean, sometimes you have an area you didn't floss, it's bleeding a little bit, you floss it, you clean it, and it goes away, right? Yay. So sometimes you have an area that needs a surgery in order to fix it, or needs scaling root planing, which is a type of surgery. And then, a lot of additional medications or anything like that. So in that situation, probably not would be my answer. So always connect with your dentist, get more information, get as much information as possible, get those gum readings, take a look at the x-ray, and discuss all your risk, benefits, and alternatives. If your dentist has any questions about orthodontics in general, please have them visit StraightSmileSolutions.com. Keep those questions coming. Thanks so much. Goodbye.